Here's a question that we can work through. A 16-year-old male received a superficial cut on the lateral side of his foot while playing football. He is admitted to hospital where the wound was sutured. 4 days later, the patient returns to the hospital with high fever and swollen lymph. Which group of nodes will first receive the lymph from the infected wound? The popliteal nodes will be the first one to accept the lymph from this swollen and infected wound, and you have to think about the venous drainage in order to figure this out. The popliteal nodes are the first group, after which the lateral side of the leg and foot will be draining. The vertical group of superficial inguinal nodes is going to be a superficial group that is just prior to the great saphenous dumping into the cribriform fossa. The deep inguinal nodes will be trailing along the femoral vein, and the horizontal superficial inguinal nodes will be trailing from the ASIS region as well as the lower abdomen. The external iliac nodes will be deeper into the pelvis, as well as the internal iliac nodes, which will drain some of the deeper perineal regions. So this question requires that we review the veins and lymphatics of the lower limb. The popliteal nodes will drain areas below the knee and lateral and superficial. Once the lymphatics dive into a deep vein, then they will not come back superficially. So after they dive from the small saphenous vein, following that into the popliteal region, they'll join into the popliteal vein, which will then come back to the femoral vein, and that will be in a deep set of nodes. As far as superficial regions, the superficial inguinal nodes have that vertical set, which drain genitalia and medial and superficial thigh, and the horizontal superficial nodes, which will drain the inferior abdomen and the inguinal region. The deep nodes, again, will be draining the medial side of the femoral sheath, as well as the femoral thigh itself.